So this is my audience for my speech. And I did my speech on autism. And Medline Plus, they define autism, or autism spectrum disorder, as it is known, as a neurological and developmental disorder that begins early in childhood and it lasts throughout a person's life. It affects how a person acts and interacts with others, how they communicate, and also how they learn. It also includes what used to be known as Asperger's syndrome and pervasive developmental disorders. It's called a spectrum disorder because people with ASD, as it's also known, can have a range of symptoms. People with ASD have problems talking with you, or they might not look you in the eye when they talk to you. They may also have restricted interest and repetitive behaviors. They may spend a lot of time putting things in order, and they may say the same sentence again and again. They may often seem to be in their own world, too. If you have a child and they go for a checkup, the healthcare provider should check your child's development frequently. If there's any signs of autism, your child will have to have a comprehensive evaluation. It may include a team of specialists doing various tests and evaluations to eventually make a diagnosis. According to the CDC, which is the Centers for Disease Control and Prevention, around 1 in 68 children have been identified with some form of autism. There's often nothing about how people with ASD look that sets them apart from other people, but they may communicate, interact, behave, and learn in ways that are different from most other people. The learning, thinking, and problem-solving abilities of people with it can range from gifted to severely challenged. Some people with it need a lot of help in their daily lives, while others need less. It begins before the age of 3 and lasts throughout a person's life. Although symptoms may improve over time, some children with ASD show hints of future problems within the first few months of life. Symptoms may not show up until 24 months or later also. Some children with it seem to develop normal until around 18 to 24 months of age, and then they stop gaining new skills or they lose skills that they once had. Studies have shown that 1/3 to half of parents of children with autism noticed a problem before their child's first birthday, and nearly 80 to 90% saw problems by 24 months of age. And the National Institute of Mental Health say that there are 2 main types of behaviors. There's restricted and repetitive behaviors, and there's social communication and interaction behaviors. Some restrictive and repetitive behaviors include repeating certain behaviors or having unusual behaviors, having overly focused interests such as with moving objects or parts of objects, having a lasting, intense interest in certain topics such as numbers, details, or facts. And then there are social communications and interaction behaviors, which may include getting upset over a slight change in routine or being placed in a new setting. Something as simple as having breakfast every morning, having the same thing, and then it suddenly changes. It could set them off. They may make little or no eye contact when speaking. They have a tendency to look at and listen to other people less often. Also, they may fail to, or they also may be slow to respond to someone calling their name or other verbal attempts to gain attention. They have difficulties with the back and forth of conversations, and they tend to repeat words or phrases that they may hear. You may also see them using words that seem odd or out of place and have a special meaning known to those familiar with the person's way of communicating. And they may have facial expressions, they might show movement or gestures that do not match with what they're saying. They may also have a usual tone of voice, which may sound sing-song or flat or even robot-like. And they may also have trouble understanding another person's point of view, or they may be unable to comprehend a person's actions. People with autism may also have other difficulties, such as being sensitive to light, noise, clothing, or temperature. They may also experience sleep problems, digestive problems, or irritability. Early treatment for ASD and proper care can reduce difficulties while helping them learn new skills and make the most of their strengths. The wide range of issues facing those on the spectrum means that there is no single best treatment for ASD, but working closely with a doctor or healthcare professional is an important part of finding the right treatment program for them. There are many treatment options, social services, programs, and other resources that can help. A doctor may also use medication to treat some with difficulties. Some medicines can be given out to have problems with aggression. They may have a repetitive behavior, hyperactivity, and also attention problems, and also anxiety and depression. And I also have a visual for someone with autism to help them as children go to the bathroom. It comes in step-by-step form with visual aid to help them, because sometimes they cannot comprehend just a simple task of being potty trained. They need step-by-step on everything. And then also Autism Awareness. Autism Awareness Month is the month of April, and this is the symbol for it. This is its logo. It's almost like breast cancer awareness, but it has puzzle pieces on it. And that is about it. Do you guys have any questions?
No.
All right. Thank you for listening.